A lot of you will have heard of the Kennedy Review. Dr. Ian Kennedy did a review of services for children within health in 2010, and it was a fairly dire indictment of the services that children get, both in the community, both in acute, the fact that they are not mini adults, that in many ways the system was letting children down, was not fit for purpose. But we are talking all children. All the work that the forum is looking at, all the work that Dr. Kennedy looked at is all children, not just our children with long-term conditions, disability, or special needs, whatever label you choose to pluck from the air. After the Kennedy Review came out, all these changes that we're all hearing about in health started to happen, and there was a white paper, the Health and Social Care Bill, that a lot of you will have heard of. I don't suppose anybody's read it from start to finish. Even if you had, it was a waste of time because it's had 1,000 amendments. Went through through the whole process of Parliament last week and is now law. So there was a lot of people sitting there in a lot of high places, and a lot of us on the ground where our feet are saying, this is very scary, this is very complicated, but where on earth do children fit? How can we get children and young people to benefit from all the changes? Luckily, there were a lot of very powerful people lobbying behind closed doors, and Andrew Lansley, the Secretary of State, decided in December that he would actually set up a children's outcomes strategy, that there would be a hard and fast piece of work that would happen over 6 months, and this was announced in January. So the two co-chairs of the forum are Christine Lenihan, who was going to be speaking, and Serene Lewis, who's a professor of oncology at Alderhay Children's Hospital up in Liverpool. They'd never met, but they found two kindred spirits. Somebody found the two right people to really get this impossible task off the ground. They invited, they being the Department of Health and Christine and Ian, invited independent forum. So the independent forum is 50 independent people, and you can find out, I'll show you where the links are, you can find out on the website who they all are, who were invited, apparently, we were told, because we were glass half full types. We weren't going to spend the 6 months moaning about the problems in the health service. We were going to try and see what we could do in 6 months to change it round. That was our remit. And you are talking about people from government. David is a colleague on it. You're talking about paediatricians, nurses, clinical people, directors of children's services, somebody from CQC, all big wide range, and 2 parents. And we were asked, there's Jackie Double, who represents long-term conditions, who has 2 sons with diabetes, and I was invited to represent children with disabilities and palliative care. I have been working with the Department on Health on palliative care outcomes for about 3 years now, so it kind of flowed. We have to report in June, so everything we have to do has to be done by June. And in June, July, which might slip slightly, but certainly by August, September, there will be an outcome strategy, and there will be a child strategy published. A lot of people have said to us, that's an incredibly short time, why? The point is that in September term, in probably about October, Secretary of State has to write what's called a mandate letter to the NHS Commissioning Board. And he will tell them what they have to do. And a mandate letter is his legal instruction. So they will be told what they have to do, and that will filter down through the system, which we will look at. What we are working on is telling him what we want him to tell them about children and young people, if that kind of makes sense. I have combined Christine's slides that she presented to the Council of Disabled Children and some DH slides as best I can, because I have condensed down into about 20 minutes, an hour and 10's presentation. But there is a list of the members on the website. The website link is there, and this again tells you about the forum chairs. The work has been divided into 4 groups, and there's a lot of cross-cutting themes, but the 4 groups are as they are there. So what I think I'll do is just tell you a kind of early thinking of some of the things the groups are looking at, just 1 or 2 things to give you a sense. because what we're trying to do is kind of prime you to what the group's doing, and then we're going to ask you to put a whole lot of stuff on paper. Public health. We've had 3 big forum meetings now, and in the last meeting it was really good, because as a disability and long-term conditions group, we challenged the public health group. Have you thought about this? Have you thought about that? They challenged us. A lot of cross-cutting, which was good. 2 of the things that came out very clearly was, and we were pushing very hard, and if I say things that we have pushed for that you agree with, do jot it down. If I'm saying things that you disagree with, please do jot it down. But we said we wanted to very much concentrate in public health on family well-being and sibling support as one of the things that needs to be measured. That we kept going on about children are part of a whole family. The system needs to support the whole family. The other thing they were talking about were what they call proxy measures, something that you can measure to test the system. They were talking about immunisation. And this was a group of quite erudite people, I have to tell you, and I was sitting there getting really more and more worked up, kept going like this, putting my hand up and saying, no, don't measure immunisation, because an awful lot of our children are immunised before we even know they have an additional need or a special need. And our children, when they're little babies, we just cart them off and they're immunised. That's not a measure of whether public health is working. And they went, OK, fine, what do you reckon? I chose dentistry. I hope you'd agree with me, but dentistry for our children is an absolute nightmare. And they all went, oh, well, that's quite a good idea. And so I gave them a few examples of children who never went to the dentist because of all the sensory stuff, because of challenging behaviour, because it's scary, because of physical access. You can't literally get in the dentist's chair. People who don't do dentistry for children with learning disabilities because it's not worth doing. All the issues. And we're talking about people who don't live in our world. And this was quite a good example of where actually having a parent saying, get real, immunisations don't really tick our boxes, dentistry would. If you measure access and take-up of dentistry in children with long-term conditions and disability against the average population, you will see whether it's a good service or not. Hopefully it'll get in there. On the acute side, we talked very much about appropriately trained staff to look after our cohort of children when they go into hospitals. Absolutely crucial. We know acute settings are a nightmare. The other thing they're talking about is discharge. Children that have been in paediatric intensive care, babies, premature babies, children that have been ill, children that have acquired brain injury, being discharged with the right care in the right place. That ticks quite a lot of boxes because keeping children in hospital, of course, is phenomenally expensive, horrendously stressful for families, and it is quite achievable measure. Mental health. Mental health, you'll be glad to know, is not mental illness. It is mental health and mental illness. And we talked an awful lot about the well-being of children, their self-esteem, their well-being, but well-being of siblings, well-being, mental well-being of families. They came up with a very interesting piece of information, which I've asked for copies of, and we will put it on the NNPCF website, is that there's been some research into targeted mental health support in schools. And if you put the mental health support into schools, it works. We all know that, but it's been proven. So the remit is to look at health outcomes that matter for children and young people. And everything that the forum comes up with will be tested against that. Do they fit into the current outcomes frameworks? And we'll have a very, very, very brief look at those. And how do the different parts of the health system contribute and work together? We are tasked to deliver outcomes that are measurable. When I started on this 3 years ago, I went to a meeting at Department of Health and I said, right, one of the things that I would like to see improved is that we are fearful, many of us are fearful of our children's future. We are fearful of what's going to happen to them, where they're going to go to school, about their health, about their way in the world, their place in the world. I want parents not to be fearful of their child's future. Well, apparently that struck a lot of resonance because the civil servant said, this is fantastic, but it's totally unmeasurable. Go away and think of something else. And then I came back to be invited on this forum and I said it again. And I said, as far as I'm concerned, I haven't gone away. It is important. It's still extremely important. It's for you guys to think of something that can measure it and come up with it, but we still do not want to be fearful for our children's futures. And so that was, again, a challenge as a parent. they are also going to have to find ways of measuring the unmeasurable. And it is proving quite an interesting challenge, but people are really rising to it. And the great thing of the forum is we have the brains of England, along with all the clinicians, plus people on the ground saying, hang on, that just doesn't work. We were given this on the first day when we were all tasked with what to do. So a matrix cube, we are having to come from this from every single angle. And the reason why I did keep this in is because we have to remember that our children are only part of this massive piece of work. So we're looking at life course. We are looking from premature babies, LBW is low birth weight babies, right the way through to young adults. Key themes. These are the key themes that we're looking at and we've talked about. Then there are cross-cutting issues, things that will affect everybody. And we have some cross-cutting working groups looking at engagement with people. We are looking at engagement with young people. We are looking at adolescents. There's a cross-cutting group looking at medicines. And then we have a cross-cutting group looking at GPs and training. So on the bottom right-hand corner, when it said education and workforce development, this is education of healthcare professionals. And of course, we all know, and the Contact to Family report on GP competence in GPs gets quoted everywhere. There's nobody that hasn't read it now. The fact is that this is where we need to start. And what is actually quite nice is that we've got a parent-carer rep from the national network going tomorrow to the first ever stakeholder engagement group within the Royal College of GPs to look at how do we do this. They haven't a clue where to turn. They've never done anything like it, and therefore we've got parent carers, we've got 2 parent carers in right from the start to say this is what you need to be doing. So lots of cross-cutting themes. There's a lot of health jargon on the bottom there. PBR is payment by result, which is hugely difficult to measure for children. Sequins are quality outcome measures and things. We don't need to worry about those. Thank you. 7 key principles for any outcomes within the NHS. I won't bother reading them, but they are shoved at us all the time. The challenge we've got is we have got to come up with outcomes that fit the NHS. These aren't outcomes that have to fit social care frameworks, education frameworks. We're working very hard, particularly with colleagues like David, to get everything fitted in together. But whatever these outcomes are, they have to be measurable. They have to be things that the NHS delivers. So you can be sitting there and thinking all sorts of things about statementing, etc. That's not an NHS deliverable. So quite a challenge. 2 complicated slides cut out of about 20. So I've taken 2. This is the NHS outcomes framework in 1 slide. And all the detail will be on our website, and there's lots more on the CDC, Council of Disabled Children's website. There are 5 domains. Anything that we come up with as a forum have to fit into one of these domains. We can add in all sorts of little layers, we can add in all sorts of indicators and measures, but we can't create a new domain. But obviously, all of these affect our children. All of these are things that we can fit, that we want in for our children. And particularly quality of life and positive experiences of care are the 2 things that we can try and really unpick for children. The next slide is even more complicated, and this is the public health outcomes framework, which only actually came out about 6 weeks ago. This one, actually, there's lots in this one that would be really, really good for children. And some of you may have been involved at an event in the Council of Disabled Children where we had a day with the council unpicking all this. So what we did then in an entire day is what we're going to do today in an hour and a bit. But we looked at all the outcomes that they have for adults. And practically every single one of them, if it was brought down to children's age, would make a difference to our children. So they have one in there about the emotional well-being of looked after children. We went, fantastic, that's brilliant. Well, can't we have emotional well-being of children with disabilities? And then can't you measure the emotional well-being of children who are mainstream children who don't have disabilities, special needs, and compare? And if our kids' emotional well-being is not as good as everybody else's, which we know it won't be, then that is a lever for change because it's proof, and that's what they're looking at. So there are lots of possible things that can be done that won't take a huge change, but if we just incorporate children into the adult world. Built into all of this is very medical, this slide. This is written by doctors, for doctors. This even calls children patients. But as far as I'm concerned, this is really a no-brainer. This is what we should be expecting. This is what every family of any child going into any medical setting should be expecting. Expertise, things to happen, people to explain to me, dignity, respect, people that listen to me, opportunity to do as much myself as I can, best possible treatment, all these things that we would all want. And this is a slide that kept being brought in so that when a group of experts come up with an outcome, we say, is that going to help these questions? So everything is being tested in all sorts of different levels. The next bit we have to change, certainly we're looking at the answers you were asking about Health Watch and leverage and change. There's two separate parts of this work. First of all, we are coming up with outcomes. What we expect to do, and what you will be contributing to in a minute when I shut up, is outcomes that will be a long list that will come down to a short list. We are probably going to come up in the end for all children with about 50 or 60 outcomes that will go to the Secretary of State. At the moment, there are 60 outcomes for the whole of the NHS. So we'll be lucky if we can get 60 children's ones in, but we are going to do our best. But the other part of it is how do we make the changes that are happening through the Health and Social Care Bill fit our children? How can the system changes benefit our children? System changes are scary. So what we've got, obviously, at the top is Department of Health and the NHS. Now, that diagram is very carefully drawn because the Department of Health, a lot of people think that the Department of Health, whoever the department is, can go down to local hospitals, local services, and tell them off because they're not doing it right. It doesn't work like that. So the NHS, some of it comes on Department of Health in terms of direction and best practice guidance and nice guidance and stuff. Some of it is really quite totally locally autonomous. It's been decided a long time ago. And when you have these problems of speaking to your local primary care trusts or strategic health authorities or local commissioners, they don't have to do what the DH tells them anymore. Their budgets, how they spend their money, they get their money, but how they spend it is is determined locally. They don't have the same sort of ring fencing that we had in aiming high. So that's one of our major challenges. The NHS Commissioning Board is being set up at the moment. There's new directors. There's going to be a director of patient participation. It'll be very interesting to see who that person is. As soon as that person gets that job, my goodness me, are we going to be lobbying them like there is no tomorrow. The NHS Commissioning Board will be instructed by the Secretary of State of what they have to do. Basically, what we are looking to do is give him the proof that he will have to tell them that they must look at children and young people at every level. And for many people, they reckon that there needs to be subgroups or sub-layers looking at children. Because if you're sitting there as a team of experts, if you don't have paediatric expertise around the table, then children and young people are going to fall off, and we can't let that happen. So there is an anticipation that there will be some structure within the NHS Commissioning Board that will look specifically at children and young people. The NHS Commissioning Board will license the clinical commissioning groups, the CCGs on the ground, and they will get a license and they will be reviewed. If we can get the National Commissioning Board to insist that all clinical commissioning groups have paediatric expertise, and we don't just mean a doctor, we mean paediatric in the widest sense, and have to have engagement with young people, parents, carers and families, that will be a big win, because then they will have to talk to us. At the moment, they don't have to. They've got all sorts of guidance and they've got all sorts of things they should be doing, but they are not instructed to. And they commission the providers. Over above that, there's Monitor, who are the economic regulators that I don't think we'll have much to do with. and CQC, the Care Quality Commission, a lot of you will have read about and the ups and downs that they've been facing. Local authorities feeding in with health and wellbeing boards. Health and wellbeing boards in some areas have got a separate board for children because it's come out of the Children's Trust. We're looking at how we can do that. That feeds up, and Public Health England is another big board. This is a big, very detailed slide. Local Health Watch are licensed by National Health Watch, so we can get the fact that you have to have children and young people's care in every level. That is something that we are looking at, and that's a piece of work that Christine is leading on, which is great. Obviously, everything needs to change, the system needs to change, and these are some of the things that needs to change. I added in at the bottom, where do children and families fit into all this? We need to keep reminding them. Right, engaging, there's a lot of work going on with the National Children's Bureau with children, and there's some links here for you to follow up. The bottom link is the Council for Disabled Children's website. There is far, far more information, far better information about all of this on there than there is on the Department of Health one. So if you want to find out more, that's the place to go. So, what are we going to do? In the Disability Long-Term Condition Palliative Care group, we decided that this is massive. This is the biggest group, it's the hardest group. So we looked at what we called pinch points, the toughest bits in our journey. And hopefully some of you will have seen emails flying around asking parents their opinions on this, and you will hopefully have a sheet in front of you. So what we agreed was the pinch points. The pinch points are getting into the system, all the trouble and the hassles and the fun we have when we're in the system, and then getting out again. So we looked at getting into the system, finding someone to listen to you, getting your first GP, somebody to actually agree, yes, there is something to do, we will forward you on to the right appropriate services. Getting into the system we know is a nightmare. Getting a quality assessment. Getting a quality joined up integrated service where people all talk to each other. And then the last one, getting out of the system, which is transition. So what you all will have are some questions, and we're going to divide the room up. And what we're going to do is we're going to have working tables of parents only, working tables at the back of grant holders, support, contact, everybody that's not here as in a parent role. And we are going to divide the tables up, and we have got the yellow, can you hold up a yellow one for me? A yellow piece of paper says, if you have major issues with getting into the system, sit on one of these two tables with yellow. What have you got here? Leaving the system. Green. Two green tables. Transition. Leaving the system. And then the pink ones, who've got pink? Can you wave your pinks? These two are pink. Thank you. And another pink table. Those two tables are being in the system. Each table will have somebody from Contact to Family or the NNPCF to kind of direct the discussions, but you have some questions, and our questions really are, what are the top 5 challenges? What are the top 5 changes? And if you've got suggestions for how this can be measured, that's wonderful. But the main thing is top challenges, top changes. Now, we've got an hour. Could spend the hour all sitting around our tables moaning about health service, or we could spend an hour getting some messages to take through to see how it can change. That's up to you.